How to lower your blood pressure naturally without medication and really fast. High blood pressure or hypertension is one of the leading cause of stroke, heart disease, kidney failures, and the list of them. And it's been shown that only in Africa, at least 46% of adult population are battling with hypertension. And in Nigeria alone, we have over 30% of adults struggling with hypertension that are refused to go down. And at least from the age of 60 and above, 90% of adults in this range have hypertension. So it's not that you can't use medication to lower this hypertension or manage it, but it's always come with its own side effects. That is it. But in this video today, I will show you how to lower your blood pressure or hypertension is called naturally without any side effects. Now, my name is Mary Matt. I'm a nutrition expert, and on this page, I teach you everything about nutrition to help you improve your health naturally. If you love to be on this channel and you love this type of video, please click this button and don't forget to give the video a thumbs up as you watch the video and share with your friends. So, what is high blood pressure or what we call hypertension? Now, the simplest definition there is too much pressure on your blood vessel, and when there's too much pressure on the blood vessel, it can cause damage, and this damage is what usually leads to heart failure, stroke, kidney disease, and all that. So you don't want too much pressure on your blood vessel, you just want everything to be normalized. Or what is too much blood pressure? What is normal blood pressure reading is 120 or below. That's for the upper number. Over number 80 or below. That's for the normal blood pressure. Now, for when blood pressure is high, then it is stated that it is become hypertension. When it is over 130, that is when it is upper number of 130 over 80 or 80. That is when it is high blood pressure. And when it is getting to stage 1 hypertension. So what are the risk factor or the things that we can call what causes this high blood pressure or hypertension issue? Number one is family history. That's your gene. If you have your mother have it, your father had it, your senior brother also, or people in your family is usually having hypertension issues, then you need to really look after your own blood pressure, because that's one of the risk factor. Number two is age. When people begin to age from the age of 45, 50 and above, stress, issue of life and everything, they begin to experience high blood pressure issue, hypertension issue. Number three is being overweight, obesity. When your weight is too much, it causes too much of pressure on your blood vessels and reduce your weight to an extent, then you see that your blood pressure will be normalized. Number four thing that causes this high blood pressure hypertension is unhealthy diet. People just eat anyhow, they don't care. And this unhealthy diet includes just eating about anything, going to different restaurants, eating out a lot, because restaurant food, eating out, they have too much of sodium, or just buying just about anything on the shelf, buying different canned food, because these things they are preserved with high level of sodium. So these are one of the things that lack of physical activity level. That's just no exercises, nothing. You're just living day by day without physically working out, without improving on your heart health, without doing something that can help your heart health to improve. Excess alcohol can cause this. So, but for adults, it has been stated that at least just a glass is enough for men in a day. And if you can even do away with it, that is fine. But most people don't even know how to even do just one cup. They have to do one bottle and all that. So, but in a place where you're trying to lower your blood pressure, bring down your hypertension, don't just go off it. No smoking, no alcohol, go off it, because these are things that put too much pressure on your heart. So these are the risk factor that causes hypertension in its own place. And I will also mention lack of stress management also causes hypertension. If you're not able to manage your stress, you will just find yourself that your blood pressure is always high. And when blood pressure is consistently always high, these are the things that causes hypertension. So that is the risk factor. Stay watching this video. Please don't forget to subscribe if you are yet to subscribe, and turn on that notification bell so you don't miss a thing on this channel. Also, remember to like the video so others can also see it as well. Now, what are the complications that comes from having hypertension or high blood pressure? Number one is stroke. Two is heart failure or heart disease, kidney disease, especially chronic kidney disease. Number four is sexual dysfunction, and number five is vision loss. So if you have any if you're experiencing high blood pressure, hypertension, please don't take this video lightly. Don't take the information I'm going to be sharing in this video lightly. Make sure you follow to the last every single thing I'm going to be sharing, because it's for your own. One thing you need to do to naturally balance your blood pressure is to practice deep breathing. You practice it consistently. Now, I noticed that for some people, whenever they want to check their blood pressure, their tension is always high. Their tension is always high. I've seen people that the thought of blood pressure alone, as a matter of fact, that thought alone raises their blood pressure to be high. So they are naturally just unnecessarily under tension because they want to check their blood pressure. Whenever I want to check your blood pressure, the nurse or wherever I want to check you to say, sit down and relax, because until you're able to relax, you won't get the normal reading. And if you're someone that is always under tension whenever I want to check your blood pressure, you will find that your blood pressure is always high. So that might be solution to somebody today, is always practice deep breathing. And whenever I want to check your blood pressure, deep breathe for at least check time it for at least 2 minutes before you check your blood pressure. That allow your body to be totally relaxed. Then you check it. So that's number one. Method is go on a lifestyle change. Now you've been doing whatever you're doing the same way. Now, like the word that say you can't keep doing the same thing over time and expect a different result, except you don't want a different result. But if you want a different result, do things differently. Now you need to go on a lifestyle change. I don't know how you've been living before, but going on a lifestyle change include changing your diet. Now, your diet, if you want to reduce your hypertension, if you want to manage your hypertension naturally without medication, is to go on something called DASH diet, which means dietary approach to stopping hypertension. Now, this DASH diet incorporates fruits, seeds, nuts, spices, and all that. So it even reduces your intake of red meat and all that. So it focuses on mostly fish that contain omega-3 fatty acids, on healthy fats from nuts, seeds, and all that. So this is a diet you should, as a matter of fact, follow. Now, in the description below or in the comment section, I'm going to drop link to a free ebook on Dash Diet, as a free 1 week Dash Diet plan you can follow if you want to start today. So it's free, it's in the description below, or I'll drop it in the comment section. You can download it, it's free for you. That's if you're still watching the video to this time. That's something free. And I have another free thing coming up again, so you need to watch the video to the end. So that is number 2 way to manage your blood pressure. Number 3 ways, by reducing your sodium intake. As a matter of fact, your salt intake. Now, for an adult, you're not expected to take more than a teaspoon in the space of 24 hours. That is when you want to reduce your hypertension. And the best way to go on this low sodium, low salt, and all that is to become a label reader, become a best friend to labels. So every single time you go to a supermarket, you go to a store to get stuff, or in the market, please always turn it around, turn the whatever it is around to check on the label to see what is on it, what is the sodium content. Because if an adult, you're not expected to take more than 1,800 milligram of salt or sodium in a day, and yet in a particular food a teaspoon contain 1,000 milligram of sodium, there's no way you will not be doing more than the recommended per day. Let me give an example of like ketchup. On it, by the time you read on it, some ketchup even have that same 2 gram of sodium per day on it. So imagine if you use, like, that's per tablespoon. That's imagine if you use about 2 tablespoons. That's using more than what you're supposed to use just in ketchup alone. That's more than whatever is inside the food. That's more than every other thing in a day. Now, let me make it very simple. That 2 gram is about 5 gram of salt in a day. That is 1 teaspoon of salt per day for you. So if you can imagine in your head that 1 teaspoon, I'm talking about 1 teaspoon, not 1 tablespoon. If you can imagine in your head what 1 teaspoon is, now let me show you. This is 1 teaspoon. So I'm showing you on the screen. This 1 teaspoon, what 1 teaspoon is. Now, this 1 teaspoon we're supposed to take throughout the course of the day. You're not supposed to take more than that. Now imagine that you still have this 1 teaspoon. Then when you buy a particular food product on it, maybe it's tell you that it is 1 milligram of one gram of sodium, or it is about whatever. Now those are additional sodiums that you're adding in a day to it. That's minus your Maggi. That's minus your seasonings. So this is why you must be a spice user and a label reader. When you're going after spices, please go after herbs. Go after the one that doesn't have an addition of salt. And this is because if you don't do that, you will be missing out on the quantity of salt and sodium you take in a day. So you can as well say, I'm using spices, I'm not using salt, I'm not using Maggi, and the quantity of sodium you have in it is even more. So you must be a label reader and a spice user. Experiment with different spices. And God bless us in this part of the world. Depending on where you're watching it from, but this is Nigeria. God bless us that we have different level of spices, and in different part of the world there are levels of spices that you can experiment with, from oregano to parsley to fennel to cumin to different spices, and all these spices also help regulate your blood vessels. So experiment with them, use them, ginger, turmeric, garlic, use them in your food. And one thing about this is that as you're even using them, they're also supporting the lowering of your blood pressure, because spice like even ginger, garlic, I mean, can also help you to lower your blood pressure. Onions can also help you, especially red onions. So these are things that you must incorporate in your food. Just be someone that's used a lot of bursting of spices in your diet. So the basic thing for this no sodium is to stay clear of canned food, processed meats, processed foods, and all as much as you can. Whole food. That's why I mentioned dash diet before. It is better because it supports whole food, vegetables, fruit, spices, nuts, seeds, fish. So it helps you to naturally, when you follow the diet, just be in the confinement of that particular eating pattern, so you're not going outside of it. So all these noodles and eggs, stay clear of it because they contain too much of sodium than your body is asking for. Of red meat. Now, red meat contains iron, which is good for your body. But when you have high blood pressure, it is best to stay off red meat for your own good. Just stay clear of excess alcohol. If you can do 1 glass a day, that's half glass a day, that's fine. And if you can do no glass at all per time, or at least no going back on it again, that's if. And the same thing with smoking, that would be fine. Lose weight. If you're someone that is trying to lose weight and you need help, please you can send me a DM and I'm going to help you. But one tip about losing weight is to manage your portion. Look at the portion you're eating per time. Make sure you're not eating too much portion at a time. For you, at least if you want to eat, maybe swallow one fist size is okay. If you want to eat your chicken, no matter how big it is, at least this palm size, it's fine, no matter how much big it is. But usually make sure it's very little, and reduce your butter, all this oil. Use quality oil like olive oil like canola oil, safflower oil. Those are the best type of oil if you can afford them. And if you can't afford them, whatever type of oil you're using, please use very, very tiny and minimum. But it is best that you go with olive oil, saff oil, or canola oil, which is very good for you. You can even go with avocado oil. So if you want to manage your weight, you need to look at your oils as well. Look at the oil, quantity of oil used per time. Don't use more than, if you're cooking for a family of five, don't use more than one that big spoon for cooking. Don't use more than it. So by the time the one that will settle in the pot, the one that will settle in the place, at least you are in the size of the oil that you should eat. That's a tip that you need to look at. Another thing is to manage your stress properly. Like I mentioned before, manage your stress. Stress cannot go off. We can't take off stress off our plates completely as humans, especially in this country where today things are not stable, tomorrow economic is like, so it is expected that we are under stress. But learning how to manage your stress properly is something you really, really want to learn how to do. Sleep when you're supposed to sleep. Don't deprive yourself of sleep. Immediately you feel sleepy, please, as long as you're not outside or you're not driving, please just go to your bed and sleep. Sleep. Don't deprive yourself of sleep. The more rest you have, the more your blood vessel is relaxed. So please sleep well, rest well. Is very, 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 very important. Exercises. Don't neglect exercise. No matter what you do, exercise regularly. Exercise regularly. Go your biking, walk 10,000 steps a day, go on the bike, do skipping, do exercises, go for aerobics, swim, dance, exercise your body so that your heart can function properly. One more thing you don't know that can help you to lower your blood pressure is cutting down on your sugary drink. Now, sugar has been found to interfere with blood pressure in several ways. So that's why when you hear they say cut down caffeine, cut down sugar and all that from your diet, and it is because it's for your own good. It's for your own good. Go with green tea, take your zobo, take your kunu aya, take your fruit juices, take your smoothies. These are best for you instead of going after fizzy drinks. And if you know that you're someone that really, really love fizzy drinks, you like something cold all the time, please make zobo your best friend because it's one of the special drink that can help you to lower your blood pressure. And there's something I need to mention. If you watch the videos to this time, congratulations. And I want you to comment, I watched this and thank you in the comment section. When you comment this, I'm going to send you a free 3 days weight loss meal plan right to your inbox. High blood pressure is usually because of some deficiency in magnesium or potassium. That's what usually said, and that's one of the reasons why high blood pressure is something that can be quickly controlled if it is detected early enough. So please make sure you're always checking your blood pressure regularly so that you quickly detect it. Now for potassium and sodium. For sodium, they say reduce your sodium, just like I said in the video, reduce your sodium. But for sodium, sodium elevates your blood vessel, while potassium reduce it. So, but if you're somebody that maybe have kidney issues, kidney problem already, you don't need to improve or increase your potassium level in your food. So you need to balance things up. So you need to know what exactly is causing your blood pressure. Some people their blood pressure is caused by stress, some is caused by their lifestyle, some is caused by their because of family history, some is caused because of overweight. When you know what exactly your blood pressure, what causes your blood pressure, it is easy to actually manage it. If your blood pressure is caused by stress, you can manage it by deep breathing, resting properly, managing your stress, and managing your diet. If your blood pressure is caused because of overweight, you can manage it by reducing your weight, go on a weight loss diet, lose weight, do a lot of exercises, and improve on your sleep as well. Because one of the things about people is that it is when your midsection have a lot to say. So if you're even obese on your midsection alone and you're not obese on your whole general body, can also cause high blood pressure. So you need to look at these little things. They look very tiny, but they are mighty when it comes to your health. So and if your own blood pressure is caused because of shock, because there are some people that is because of certain situation in their life that cause their blood pressure to increase, maybe shock of somebody dying or something, some incident that happened, they need to see a therapy. You need to manage that situation. Start with your mind, start the breathing, managing it, talk with the therapist about it, and manage it with also with your diet, and look at these things I mentioned as well. So this will help you a long way. So if you're watching video to this place, thank you so much. If you have not subscribed, please click that subscribe button and also the notification bell so you don't miss a thing and video. A big, big, big thumbs up and share with your friends and your families. Until next week again, please take care of yourself and manage your blood pressure naturally, no medication at all, and you'll be good.